Hi, Dr. Prakriti.
Hi, Gitika.
Could you please tell us something about Doctors for You?
Sure. So, Doctors for You is an NGO which actually started in 2007. And we had a vision of providing equitable, efficient, and quality healthcare. And we believe in the concept that health should be for all, irrespective of the caste, creed, or the socioeconomic conditions that people actually have. And we feel that everybody should be able to get all these services and irrespective of the amount.
So, what are the types of programs and strategies that are made by Doctors for You?
So, Doctors for You actually works in crisis and non-crisis situation both. Health is our biggest program that we do apart from the disaster response. Apart from this, we actually work in capacity development, emergency preparedness and response, trainings, and skill development as well.
Okay. So, what do you do exactly?
Okay. So I am Dr. Prakriti Kashyap, who happens to be one of the directors in Doctors for You. I head the clinical health and the health centers head. So under this, we manage a lot of like clinical health centers, then mobile medical unit projects, then any other intervention that we are doing, which somewhere is related to medicine. I take care of that.
That's great. So, what is your strategy for Mpox? Is there any as of now? If yes, then what is it?
Okay, so Mpox as of now is not a burden at the moment in India because since 2022 till date, we have had like 30 cases. And for the last 6 months, so the last case that we actually had was in March. So we are all being very vigilant because this illness that we have, it's a viral illness and it can spread through direct contact. So we are very vigilant. We are looking into what all precautions we should be taking, how it's spreading. So, all the awareness that actually is there that needs to be addressed to people and people need to be told about, we are looking into that. And what I feel is that any person who may develop a rash should be even more cautious because any person who if get infected by the virus, they would start with maybe fever or some rash in 1 to 2 days. The illness may take like a week or 10 days to fully flourish. And then you can get some flat red bumps, which are painful, and that can happen over your face, hands, feet, genital areas, anywhere. And other symptoms kind of mimic the general viral illness that we have. And one of the things that is most important is social distancing and hand hygiene that can help, to prevent yourself from getting the illness.
Do you feel that the awareness regarding the disease is very less in India as of now? And since World Health Organization has declared it as a disease which really needs to be taken care of and controlled well on time, we need to take more measures.
So the thing is that since we do not have the case load at the moment, so we are at a very good position so that we can prepare. So screenings have already been there. So since the time the outbreak has happened, generally screening has been done, and luckily we have not found any cases, especially people who are coming from abroad. That is very important. So I feel that awareness is there. But yes, you know how COVID times was. So the awareness was there in the starting and that actually kind of helped. So we expect that if people are already aware and if we can maybe scale it up even more, I mean that would help us fight the illness in a much better extent. But I think we are at a good place right now.
That's really nice that you feel we are at a good place, that gives a lot of reassurance to everybody. And Prakriti, do you feel Mpox can cause a situation that was caused by COVID, a complete lockdown, or do you feel that this wouldn't happen or this might happen? What's your opinion on it?
So the illness in itself is self-limiting, but definitely it has a lot of contagious power. So, and the rashes and the kind of symptoms that people have, and it can spread fast. So, in that way, I mean, definitely it can cause problems, but because COVID had a lot of variants, and each variant brought its own symptoms and its severity in terms of the systems it can affect in the body. So, that is not the case as of now with Mpox. So, I believe that. It may not be as worse as it was at that time, but I think again the immunities and the socioeconomic backgrounds, the environment that actually affects it a lot.
Okay, so suppose it spreads and it increases, what should be the strategy, or do you feel that India is at quite a good place to ensure that it doesn't spread at a drastic rate?
Right. So, one thing is for sure that, even when the COVID came to India after quite some time when it was there in the entire world. So, I think we can take a lesson from that, which is why we are doing the screening and everything, and we are spreading the awareness. Mpox is again a contact illness. So, any bodily fluids or respiratory droplets that actually are contaminated with the virus can spread the disease. So if somebody is already suffering and they have their beddings or anything that has been in contact with that person is fully capable of spreading the disease. So in that way, we are kind of in a similar manner when we are talking about COVID. But because we already know this right now, and everybody, because of the COVID, is good with social distancing and hygiene. So if we just promote that, and if somebody develops any kind of symptoms of such sort, they should immediately, contact the healthcare provider, and we can get them tested and get to know if they are suffering from Mpox, and probably then, the people who are surrounding that person can isolate themselves and maybe not come into contact with any person who is suffering from the disease.
Okay. Ma'am, would you like to share some success stories of doctors for you?
Okay, so because Mpox does not have a lot of cases in India, only 30 confirmed cases since 2022, so almost 2 years, and not a lot of cases. So we did not get a lot of opportunity to work on it. But yes, we are definitely spreading the awareness as much as possible. We have our own SOPs, which we are inculcating, especially in our healthcare setups and any other programs
So,
that are involved with
this
outreach.
awareness that you're spreading the awareness in rural areas as well as urban areas.
Yes. So any outreach program that Doctors for You has, we try it because like all the outreach programs are in a way designed, to decrease the community burden to lots of diseases. And because such kind of diseases are dependent on, hand hygiene or social distancing, that kinds of makes it quite easier to, to explain it to people that, just you maintain this and you'll be fine that way. So, I mean, we are trying to ensure that we just keep continuing that in all the programs wherever possible.
So, was there any program which was really successful for doctors for you, which you like to share about?
So I would again say that because we have not had experience in terms of this disease spreading in India. So it's always and had been precautionary from the last 2 years. So any measures that we are recommending, it's all precaution based. If we feel or if we get the news that the caseload is higher, we would probably try to scale it up even more. As of now, it's like uh, any program that generally deals with any outreach activity, let's say wash practices or a health center where we are dealing with infectious disease on a day-to-day basis. We try to explain or train the staff that this is one of the illnesses that is something that we need to be vigilant about, and these are the measures that we need to take care of.
What suggestion would you like to give it to individuals and organizations which want to come up and do something for MPOX?
Awareness. So awareness is the most important thing. Like people should know what kind of symptoms they should look for. If in case the caseload rises, or if we feel that that is something that we have to take care of, and precaution, which is like social distancing and hand hygiene, like most important. So hand hygiene would again be similar steps like it used to be in COVID. Either you sanitize your hands or you wash your hands thoroughly with soap and water.
That's really great. Would you like to share something about your company with us?
Uh, so, um, so what I feel is that the Doctors for You, we generally want that, before anything happens, we should be prepared. So there are lots of conditions that we are working on, and there are a lot of already problems that community is facing. Like for example, TB is one. So, like we feel that all the health initiatives that we take should reach the last mile, and anytime if something happens, everybody is prepared.
That was the
And
mission for forming Doctors for You, is it?
right. So another thing that I would like to highlight is, bridge the gap. So see, government has its own guidelines. They are doing so much. And certain times there are certain things that, they fall short. So we as an organization want to come forward so that, hand in hand as a public private partnership, we can work together and ensure that, all the people are in the best case scenario.
Thank you so much for your valuable time. Thanks a lot. Have a lovely day, ma'am.
Thank you, Kritika. Thank you so much.